Thank you all so much for being here. I'm Mary Beth Donahue, President and CEO of the Better Medicare Alliance. And as I look around and saw folks coming in this morning, I'm just so grateful to see familiar faces. And I know we're way past post-COVID, but they're just opportunities to continue to be grateful to be able to see people in person. So thanks to those of you who are here today and will be joining our panels later today and tomorrow. So thank you. In the room today and throughout the next couple days, we'll have several policymakers, members of Congress, our BMA allies, and folks from throughout the healthcare policy community. Some of the folks who will be joining us include CMS's Principal Deputy Administrator, John Blum. He just arrived a bit ago, so folks might have already seen John. Also, we'll be hearing from Nancy Lamond, the Chief Advocacy Officer at AARP, as well as tomorrow, Jim Breckton, who came on board as Humana's new President and CEO, and then several of our allies who are here today. Thank you. A lot of what we're going to be focusing on are key issues of importance to the Medicare Advantage beneficiaries and the allies in the community. And we'll be hearing from experts like yourselves. So thank you so much for making that possible. And these events do not come together without a team behind it. And so I do want to thank the BMA team and those allies who supported these couple days in making this possible. As many of you know, the Better Medicare Alliance is the lead research and advocacy organization focused on Medicare Advantage. And we do that working alongside over 200 allies and over 1 million senior grassroots beneficiaries. And we focus on keeping healthcare affordable and keeping quality healthcare. And in the process of doing that, we don't want to lose sight of being able to focus on improving health outcomes.In December, whether at the celebrations is in December or next year, Better Medicare Alliance is going to be focusing on a 10-year anniversary. And as we look on those past 10 years, our mission hasn't changed. It's continued to focus on strengthening and protecting the Medicare Advantage program. And we'll never lose sight of focusing on building a healthier future for those beneficiaries, despite whatever challenges come along the way. And I will be speaking to some of those challenges this morning. When we talk about Medicare Advantage, as I just referenced earlier, we focus on quality, affordable health care. And I want to focus first on that second word, affordable. Some of you may have seen the national poll on healthy aging that they put out recently by the University of Michigan. The key finding was this: older Americans are extremely worried about the cost of health care. The poll asked seniors to rank their concerns when it came to health care. Here's what topped their list: the cost of medical care, the cost of home care, assisted living, nursing home care, the cost of prescription medications, and the cost of health insurance, the cost of dental care. You obviously see a constant theme. And of course, seniors also focus on quality. They care about access, about being able to find hospitals and providers who are in their network area. But more of that what most matters is seniors having access to the care, but can they also afford it? And that's why affordable coverage through Medicare Advantage is so important. And the numbers are powerful. Medicare Advantage beneficiaries spend $2,541 less on average on premiums and out-of-pocket expenses than those in fee-for-service. In simple terms, that is more than $200 a month. For seniors living on fixed incomes, that can be the difference between buying healthy food and groceries one week or not. It can be the difference that allows them to invest in home repairs, pay their water and electric bills, or buy that plane ticket to visit their grandchildren. It's a difference between financial stress or peace of mind. And at the Better Medicare Alliance, we take our role seriously as the voice for Medicare Advantage on behalf of our allies and those Medicare Advantage beneficiaries. And I want to just share a few stories that remind us of examples of what I was just referring to on the importance of that affordability and access to care with a few senior stories. Senior Stephen H., a senior in North Carolina, suffers from a rare form of blood cancer and type 2 diabetes. Stephen says that without Medicare Advantage, he would not be able to afford his medical care. David E. from Arizona, he says that he would not be alive today if it weren't for Medicare Advantage. When he experienced a heart attack in 2019, it was his Medicare Advantage plan, that made it possible for him to receive life-saving medical care. And then Darlene G. in Michigan, who, like many seniors that I just referenced, lives on a fixed income. Without her affordable Medicare Advantage health coverage, she does not know that she would survive. And again, those are just a few examples, and many of our allies here today know this firsthand, and many of you with family members in Medicare Advantage do as well. It makes me so proud of the work that we all do together alongside others in the Medicare Advantage community. And this work is more important than ever. And as I mentioned, we have challenges, and Medicare Advantage is at a critical moment right now. On the one hand, we have more Americans choosing Medicare Advantage than ever before. Nearly 34 million seniors and people with disabilities are choosing Medicare Advantage. That's 55% of the Medicare population. Again, I want to repeat that. The majority of people enrolled in Medicare are choosing Medicare Advantage. The promise of Medicare Advantage as an affordable health care option for seniors has never been greater. But those of you in this room understand, and maybe why you're here today to learn more and share your expertise with us, know that navigating is difficult and challenging in the moment that we're in. Several years of significant policy changes, fiscal pressures, and a rapidly aging population are putting pressure on the Medicare Advantage program. 1 month from now is going to start the mark of the Medicare annual open enrollment period for seniors. This is the time of year, as many of you know, when seniors have the opportunity to weigh in and choose their healthcare coverage and look at those Medicare options. And for the reasons I just mentioned, Medicare Advantage plans are going to look different for seniors. That might mean fewer supplemental benefits for their money. And in some areas, some seniors may have fewer plans to choose from. We need to be clear. Washington policies, those fiscal pressures, and the rapidly aging population are putting pressure on the Medicare Advantage program. But the real impact is felt by seniors, and that's what we need to continue to remind policymakers of. The good news is that we expect most seniors will still have access to $0 premium and low premium plans through Medicare Advantage, and they will still have access to a range of supplemental benefits. Medicare Advantage remains the best value and the highest quality coverage a senior can choose. Also, many believe that a majority of seniors will continue to decide that Medicare Advantage is the best value for them. Yesterday, the Better Medicare Alliance released its annual State of Medicare Advantage report, and you'll be hearing us throughout the next couple of days referencing some of the facts that we've learned from that report. Each year, that report brings the latest data together on the story of what Medicare Advantage is today, and most importantly, where the program is going. I'm always proud of this report because we consistently get feedback on the resource this provides to not just the Medicare Advantage community, but the healthcare community. And so I encourage you to share it within your networks. What's clear from this report is that the face of the Medicare Advantage program is evolving and becoming more representative of this country. I just want to give you a few highlights and teasers so you'll dig deeper into the report. The share of Black, Asian, and Latino beneficiaries in Medicare Advantage continues to grow. It's now more than 30% compared to 18% in fee-for-service. And the share of rural beneficiaries is growing. And today, it's almost 4 times what it was in 2010. Also, enrollment in special needs plans is growing up 14% just in the past year. Overall, Medicare Advantage has more than doubled in the last decade. And even as the program grows, Medicare Advantage continues to provide quality care with better health outcomes. As our State of Medicare Advantage report highlights, 95% of Medicare Advantage beneficiaries say that they're satisfied with their health care. Now, I can't think of anything that 90%, 95% of people would agree on in this country, let alone something as important as health care. That is what building a healthier future looks like. And that's why Medicare Advantage policy matters. When it comes to Medicare Advantage policy, there are things we can do not to just protect the program, but to improve it. Better Medicare Alliance has been committed to finding common ground and advancing common sense policy solutions where we're aligned with policymakers to strengthen Medicare Advantage for seniors. Earlier this year, the Better Medicare Alliance was pleased to endorse the Improving Seniors Timely Access to Care Act in Congress, along with hundreds of other healthcare stakeholders, including several of our allies in this room today. This bipartisan, bicameral legislation would finally make electronic prior authorization a priority and an industry standard, reducing unnecessary care delays for patients and providers. And as someone who comes from the era when the fax machine existed, this would mean the era of the fax machine is coming to an end. Senators Marshall, Sinema, Thune and Brown, and Representatives Del Bene, Kelly, Barrett and Bouchon have been true leaders on this issue, and we're so grateful to them for their work. This is just one recent example of how we can strengthen and improve Medicare Advantage through sensible policy solutions. And we think it's just the beginning of what's possible. The Better Medicare Alliance has also proposed reforms in the areas of provider directories, in-home health assessments, and Medicare Advantage marketing and more. And we're just getting started. Innovation is part of what Medicare Advantage, what makes it so special. It is in the program's DNA, and it should be in our policy approaches as well. In addition to the importance of innovative policy solutions, we also need to focus on stability, especially in light of the policy changes that continue to be made to this program. Seniors shouldn't have to question whether they'll be able to afford their health care. Seniors shouldn't have to worry about losing access to their supplemental benefits. And they shouldn't have to wonder whether Washington will protect their Medicare Advantage. Because what might look like a small change on paper can be very significant to one senior. For example, a senior managing a chronic health condition who's just trying to afford their medications and still make ends meet. Which is why we're urging policymakers to exercise caution. And as we move forward, to consider the extensive changes already made to the Medicare Advantage program. The magnitude of these changes is unprecedented. We're already seeing the impact on seniors, and unfortunately, it will be years before we see the full picture, but we need to look for it. And while we all want to strengthen Medicare Advantage, there is risk in doing too much too fast. The good news is, and there's always good news, I am confident that everyone in Washington does agree providing affordable health care for seniors is essential. And the question is, how do we deliver on that promise? I'm so excited for the next couple days, and I'm so excited for those who are joining us to again share their commitment to providing this affordable quality care to seniors and to be able to share their knowledge on the value of the Medicare Advantage program. And again, where we need to strengthen it, but where we need to continue to improve.